Cambodia is in Southeast Asia, bordered by Thailand to the west, Laos to the north, Vietnam to the east, and the Gulf of Thailand to the west. It is a land of great beauty and amazing monuments, including the spectacular Angkor Wat. Unfortunately, Cambodia has had a devastating recent history. During the 1980s, the reign of the Khmer Rouge and Pol Pot destroyed the country. With their reverence to Mao's communism, they rejected all things Western in an attempt to rebuild the country's agriculture on the model of the 11th century. They destroyed temples, libraries, and anything considered Western. The only way to accomplish this was to kill the intellectual class. Doctors, lawyers, teachers, anyone who had soft hands or wore glasses was targeted. Fathers, mothers, brothers, sisters, workers, and farmers were rounded up and executed. This era gave rise to the term the killing fields. Over 2 million people were killed. That's 1/4 of Cambodia's population. 1 in 4 killed by a murderous dictator desperate to control a country. After such atrocity, how does a country and a community recover? With warmth, compassion, and determination. Creating Partnerships for Progress has been working with such people in the rural communities of Kampong Speu province in Cambodia. Sareth Brack, a monk in the province, started a Cambodian nonprofit organization called Raise and Support the Poor to help his community. In the span of 10 years, he has built multiple schools and provided guidance and stability to a rural community of 25 villages and over 10,000 people. The community looks to Sareth for assistance, and at the age of 32, he is considered the community elder. It is in this capacity that he first mentioned to CPP the need for a primary care clinic, and it was while CPP volunteers were in Kampong Speu that they saw firsthand the great urgency for such a clinic. During June and July 2012, a highly communicable infection was sweeping the countryside of Cambodia. Hand, foot, and mouth disease, which is very treatable and mostly benign, was killing children due to a lack of primary care and dehydration. Daily, while our volunteers were building the library, families would come to the building site to bring their sick children to Sareth for guidance. Since there are no doctors in these villages, and no easy way of getting to the nearest doctor in the capital, Sareth has become the answer to their concerns. It is with the small monies that RSP receives through donations that he purchases medicine to dole out to the families of the ill. Why is there no hospital? No clinic? No doctor? No first aid of any kind? The answer is simple. Extreme poverty and a full day's walk to the nearest hospital prevent most people in the area from seeking medical care when it is needed. It is this crippling poverty and its associated problems, such as a lack of clean water and poor indoor air quality, that contribute to a number of health problems among the population. Access to basic medical care is among the most striking benefits to a family and community. By effectively addressing the most common health needs of children, primary health care can bring the greatest benefits to the health of families and communities. It is in this context that Creating Partnerships for Progress will be assisting to build a primary care clinic in Kampong Speu province, Cambodia. But this project will require the assistance of partners. It is through your donations that together we can build a place where children can receive their first vaccines, where basic first aid can be provided, where education about hygiene, sanitation, nutrition, and dental health can all be taught. Your donation will promote healthy living and disease prevention, and provide a foundation for human dignity to flourish.